So the benefits can be enormous, obviously, because depending on the type of cancer a patient might have, it can completely, as we say in lay terms, can wipe out their fertility potential. So in some cases, if the radio, for example, or the chemotherapy it's quite harsh to the testicular environment and to the spermatogenesis. After the end of the treatment, there can be cancer patients who have no sperm at all in their ejaculates, and these patients they won't be able to produce any sperm for the rest of their lives. So the benefits before a cancer patient starts the medical intervention are enormous, because they can store sperm before they start the treatment, and once they finish off the treatment, they can use that sperm in the future to go ahead for an assisted reproductive technique. And that doesn't mean necessarily that they have to use it. There are other cases where, for example, the chemotherapy is is not expected to have a severe effect on their fertility. So some patients, although they have stored sperm in the past, they don't need it after their medical intervention, because their fertility hasn't been greatly impacted. Usually, when a patient has been through cancer and they have finished off their treatment, we say a year after a patient stops their chemoradiotherapy, they go to the lab, they assess the sperm again, they assess the semen quality, and then they take things further in terms of if they need to use the frozen backup or not. And also something that is very important for men to know, and depending their country of residence as well, they need to check the legislation for how many years they can store the sperm. We have seen cases where patients, they didn't keep contact with their lab, with their fertility lab. They had cancer, they have stored sperm before the initiation of the treatment. They were very young at age, so being fathering a child wasn't obviously on their mind, and also by the fact that they had to deal with cancer, uh, 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 fathering children wasn't something that they would think. And then they didn't keep in touch with the fertility lab, and after 10 years the lab had to dispose of had to either had to contact the patient and discuss obviously the opportunity to extend their consent to get a consent for the patient to extend the storage period. But if in some countries, as I say, and as I said again, that depends on the country, I guess. If the lab can't keep contact with the patient and the consent of the storage has expired, they might have to discard the samples. And if a patient has been through cancer and the chemoradiotherapy was quite harsh, for example, for spermatogenesis, those patients end up having no sperm, no frozen backup to use. And this is something that they need to take into account. Store sperm before you start your cancer treatment, and then always keep in touch with your fertility lab after you finish off your successfully treatment.